Well, afternoon, everyone. So the post-lunch slump should now have moved on, so your bright, sparky sprint to the finish of the day. Now, I'm going to start off really coming from left field a bit, just an extreme view on well-being, looking at American pilots in World War II. So the American Air Force wanted to reduce their casualties. So they thought, well, let's look where the plane's getting shot and we'll put armour on them. So they thought, well, let's, they studied the planes coming back and they looked at the wingtips, center, tail fin, until a statistician, a guy called Abram Wald, said, no, you want to armour the engines, the cockpit, and the centre of the fuselage, where the planes were not shot. Can anyone guess why? Exactly. Looking at the wrong data set. So I want you to bear that in mind. The ones that really mattered weren't in the data set. So with that in mind, look at this. This is from our own data set. It's looking at the average risk count in the population as they get older. And we see the average risk go up, and then from the age of 55, it comes down. Now, you choose. Either at the age of 55, you get a revelation, transform your lifestyle, or you vanish from the data. And this is actually the challenge we are all facing today, in that actually our older, most experienced, most valuable members of staff are vanishing, and we probably aren't really even seeing it. There is a very tight relationship between the accumulation of health risk and performance. Now, what are we looking at? So we've been involved in working with REBA on the research, and there's some quite interesting insights come out of that. And there is a real lack of data. And in fact, even where we see what is being measured, it's more around engagement levels and participation, not what are we actually getting? Are we actually making a material difference to our people through our wellbeing programs? The days of well-being as purely maybe an entertainment exercise has to be at an end. It's about, can we deliver real health outcomes? And from a personal point of view, I'll come back to this later, but what we're really interested in is supporting behaviour change, but through a mechanism of individuals understanding the benefit to them if they change. Financial incentives, those kinds of mechanisms, behaviourally, the science basically says you need to pay people a ton of money to get them to change, and then when you stop paying them, they go back. So what we're really interested in is how can we build those individual relationships targeted to those people most in need. So I want to hand over to Tracy and talk more about her experiences with AXA in Syngenta.
Hi, everyone. So Syngenta is probably one of the global companies you've never heard of, because I hadn't heard of it either. We're a science and innovation crop solutions company that work very closely with the agricultural world, and we care deeply about food security in a sustainable way. But what that really means is that the people are at the heart of what we do. We have 28,000 people globally working on over 200 sites in 90 countries, and that's quite difficult to get your arms around. More closer to home for us in the UK, we're 1,600 people, peaking at 1,800 in a seasonal peak. But they're spread out. They're across 8 sites. Those sites can range from 12 individuals to 600. And they range from research and development, manufacturing, commercial, harvest workers literally working in a field. So that's quite a complex environment and a complex group of people to get your arms around from a wellbeing and health point of view. And that was a real problem for us. Solutions had grown up locally at sites, and I had a lot of people that weren't even at a site. I had salespeople driving around in cars and people working from home. We didn't have a consistent core offering. And when I joined Syngenta 3 years ago, I really struggled with that, having come from big corporates. It felt like a bit of a postcode lottery about what your experience at Syngenta would be like from a health and wellbeing point of view. So I decided I ought to do something about it. Clicker's working. So as I said, we're quite geographically diverse, we're quite spread out, and we're quite different. Manufacturing, we're presenting with lifestyle risks. Commercial and some of my office-based staff were presenting with stress. It was a difficult situation, and there was no one-size-fits-all solution that was ever going to help us. And we're a very, very, very small UK HR team responsible for everything. So we needed something that would be holistic, engage people proactively in taking responsibility for their own health. And as I mentioned, we're a science community. You don't get to work in a science community and have credibility unless you can be data-led. Being data-led in health and well-being is quite difficult. And I had a large group of people who needed something that wasn't face-to-face all the time. We have a lot of sites where there's no HR person, no occupational health person, no HSE person on site all the time. And as I mentioned, we had people who were just lone workers. So I needed something that had a digital footprint, something with digital access, and that could be a bit more holistic. But I wanted something that would work with employee engagement as well, something that where we could run campaigns, a bit like the Years Younger campaign that AXA are running. So we launched Proactive Health through using the Health Gateway. And in the first couple of years, we were able to just look at what do we think our problems are at each of our sites. We used local knowledge, we used people, the fact that we used our local experts to tell us what they thought they knew and give us examples that they were seeing on the ground. And we were able to develop something that had a core, consistent offering, so getting rid of the postcode lottery, but that also had the ability to be tailored. I've got 2 manufacturing sites that run shifts. They need something different to my massive R&D site that has 600 people at it working in labs, greenhouses and offices. So it needed to be able to be flexible enough to be similar, be a core offering, but be flexible and be able to be tailored to specific needs. So let's just have a closer look at that. Here are a couple of my sites, and you can see one of my sites there in Scotland, manufacturing site. We were able to really tailor intervention for them around lifestyle improvements. They had poor diet, they had disrupted sleep patterns, and you can probably imagine a manufacturing site, smoking, drinking, those kind of lifestyle risks. In the south, I had an R&D site with 600 people doing really, really different jobs, and actually what we were seeing there was we needed interventions relating to stress. And so we were able to develop something that was tailored to support some of their lifestyle and specific needs. What particularly was important for us with the AXA Proactive Health offering was that we were concerned about people's mental health. It's really obvious to us that people's mental health and physical health is inseparable. You don't leave your mental health on the passenger seat of the car when you park your car in the staff car park in the morning, and the two are inextricably linked. But, as I've said, it's a science and a manufacturing community. Neither population particularly well known for talking about mental health or emotions, and it's always been a bit of a taboo subject within our culture. It was also really clear that where we did have sites where there wasn't necessarily a HR person, an occupational health person, or an HSE person on site all the time, they weren't going to be able to provide those solutions. So we have spent some time training up people using the 2-day mental health first aid training so that we have mental health champions across all of our sites. These aren't necessarily managers, HR people, or specific special people. They're just people who volunteered that we deemed to be a suitable candidate to hold the role. We meet with them quarterly and we just check in, see how they're going, and see the kind of things that are coming up. And I'm really proud to say that we're starting to banish the taboo and we're starting to open up the culture a little bit. And we're seeing people feel more comfortable about talking about mental health in the workplace, which is quite a big step forward for Syngenta, particularly where a large group of my staff don't even have a line manager in the country. So it's a really good resource for our people. So I talked about being a science community, needing to be data-led. In 2019, we were able to, for the first time, to have enough trend data from our gateway statistics and our information to really sit down and go, what do we want our strategy to be? What do we want our annual plan to look like? And how are we going to specifically tailor that to each of our sites whilst maintaining the consistent core? And actually, from our perspective, this builds us a huge level of credibility with quite a scientific leadership community who do expect us to prove that we're spending our money in the right place. So let's have a look at that in a closer look. Here's two specific sites here that can show how we're really able to measure that impact now. So three sites, Grangemouth, Manchester and Huddersfield, two of those sites being manufacturing sites. You can see that across our journey from 2017 to 2019, we've not only increased our utilisation, so hopefully reaching beyond the consciously well Fitbit wearing community, but we've also managed to really reduce our health risks in blood pressure and BMI. And that's really tangible for me, and that's something that I can take back to my data-led science communities and start really championing the money we spend on health and well-being and get them to realise that investing in the people is the right thing to do. So it results in engagement, morale and motivation. We have reduced 400 health risks since we launched the service. We're also 96% of our way to our 800 years younger pledge. So we pledged 800 years towards AXA's overall target, with the hope that actually if we get there before 2020, we might up this to 1,000. Now, 1,000 years is quite ambitious for a company with less than 2,000 people. And we have actually been able to say that we've seen a reduction in our claims costs around disease risk. We can't link this because it's not possible to do that. But we've never seen a reduction in disease risk before, and I do have an ageing population, so it was not quite what I was expecting to see. And I can only really draw the conclusion that we've done this through proactively focusing people on their health. So what's next for us? We are going to use a greater personal support programme with using our intervention fund. We've just recently launched AXA's occupational health offering, and so we're looking at how we bring the two together holistically so that the proactive health can be in the toolkit for occupational health support. And we're launching Check for Cancer. Check for Cancer is quite an interesting bit of the story, actually, because this came up from the ground. As a result of the engagement that we'd managed to get within the community by using this service, they asked us at one of the sites if we could do this and offer it as a service. So we spoke with AXA, and it wasn't something they were currently offering, but they were very, very supportive and went away and came up with a solution. And we'll be launching this at a number of our big sites this year. So this is a really, really good example around I'm able to tailor what I need, but I'm also able to have quite a big ask and get something quite specific, and it's not just a cookie cutter. I can actually ask for something that doesn't necessarily always fit the standard offering. Okay, back to you.
Thank you. So just to wrap up, talking about really targeting, needing and supporting behaviour change, one thing we have been working a lot on is really the health coaching model. In order to target your budget to those who most need it. So one of the biggest accusations against Wellbeing is making fit people fitter. What we want to do is really get those, what have been called hard to reach. But actually that's for me a complete misnomer. They've never been hard to reach. They've just never wanted anything we've offered them. Because why go through an assessment when it's telling you something you already don't want to know? Okay, whereas you go with a solution, those supposedly hard to reach actually engage much more readily. But there's a very big psychology lessons we still need to learn about bringing those people in. So thanks to the contribution of Syngenta, we are now 41,000 years to our target of making the UK 50,000 years younger. So for those who are not familiar with the health age calculator, we offer through the Gateway a health age calculator which effectively converts your risk into an age. Obviously, we wanted to deliver that 50,000 by the end of 2020, which we're looking good for, and happy to talk more about that if you're interested too. So I think we can get some questions in.